Hello, everyone, and welcome to another segment of Leaders of Asia. Today, we have with us Dr. Sandeep Chatrat, Global CEO, Hospital Strategist at Labid Hospitals. Whitepage International has selected Dr. Sandeep as one of Asia's 100 Inspirational Leaders 2022. Today, we are going to talk about digitalization and healthcare. Dr. Sandeep is an accomplished medical professional with 3 decades of comprehensive experience in medical care and hospital administration. He is a professional with medical and management background, having diverse experience in the field of healthcare industry, ranging from managing operations of super specialty hospitals, regional or cluster head, to group chief for healthcare organization. His core strengths are leadership, hospital operations, business development, control cost, improving quality systems, managing hospital and healthcare projects. He has worked as CEO for leaders in hospital industry, including Apollo Hospitals, Fortis Healthcare, Wockhardt Limited, Sir Gangaram, CK Birla Hospital, and Metro Hospitals and Heart Institutes. Dr. Sandeep possesses necessary skills for fast-paced business development, has strong network with medical fraternity, corporates, and communities, and has excellent leadership skills for managing organizations. He's a change agent during performing organizations and turning underperforming organizations into profitable business units. He's a successful and entrepreneurial P&L CEO and business development analyst. Dr. Sandeep is also a quality systems assessor at National Accreditation Board for Hospitals and Healthcare Providers. Hello, doctor. How are you doing?
Yeah, great. It's really great to be part of this program. And I really want to, first of all, thank Whitepage International for awarding the top 100 inspirational leaders in Asia. And it's great to be part of this interaction. And thank you for your kind words and your greetings. And look forward to a wonderful interaction.
Sure, sir. So talking about digitalization, the whole world has been taken over by the evolution of the digital marketplace as we see it today. So even in the healthcare centers, we see so many apps that, allow us to order medicine online or consult doctors online. So how do you think that digitalization has affected operations at your hospital?
You see, today, digitalization is the right arm of the healthcare. Especially, it is catalyzed by the COVID experience, the digital wave. And now you'll see the telehealth and virtual consults. Around 5 to 10% of our consults are teleconsults and virtual consults. Earlier, this was not the case. So doctors have become more tech-savvy. And especially, I would like to highlight that the cost-effective way of marketing on the social media is also a very important contribution of digital health. And of course, now hospitals cannot run without a very updated and a very grounded hospital information system. And to run a hospital successfully, you need various applications like picture archival systems. You need to have a point of care cloud-based computing, and mobile technologies are one of the most important wearables, especially smartphones. You have seen people smartwatches wearing, and I think it's important to take care of our health and making a difference for patient. E-prescription. And I also want to highlight about artificial intelligence, because predicting of cardiac events early through artificial intelligence, and analyzing the various cancer MRI films through artificial intelligence in short span of time. So digitalization is capturing the patient feedbacks virtually on the real-time basis through the applications. So Darwin Box is another important hospital information system, or HRIS for hospital human resource. Similarly, there are so many new innovative things which are there in the digital space, which is happening, and cannot imagine a hospital without digitalization, because My Health Records and health summaries, EMR, the electronic medical record systems, and e-prescriptions, they are all like bread and butter in today's time.
Like we know that change is necessary, but it's also very difficult. It comes with a lot of resistance. So since with the environment has been constantly changing, how has the human resource at your organization been coping up with the current trends, especially after COVID-19 hit the country and made matters much worse?
Yeah, so after the COVID, there has been a lot of changes. Especially, I would like to highlight on the remote working because COVID has done this, that the remote working has become also a very important part of human resource and hospital delivery. As I mentioned about teleconsultations. Now, earlier we never used to have Zoom meetings that frequently. They were more face to face. Now, without Zoom has become a very important medium for conferences, for interactions. And also, I would like to highlight that the new normal per se of use of masks, sanitizer, social distancing, all has become like the important part in the change post-COVID. And also home care delivery also is one area which has taken more impetus, virtual consultation, and managing mental health. I want to specifically highlight when we are talking of human resource post-COVID, because due to the enormous stress imposed on the healthcare workers during COVID times, not only they fought the disease, they lost their near dear ones, and there is always the mental health training and development part in human resource especially got more impetus, as well as various e-learning initiatives. And so these are few thoughts in light of change for the COVID on human resource side.
Thank you for sharing these thoughts with us. My question is that what is something that you would like to say to people working in healthcare? Any sort of advice or suggestion?
So you see, the most important advice I want to give is that you need to have a work-life balance. That is very important in today's time. And in healthcare, the retainment of the talent is the main challenge, because continuous change agents and the opportunities are coming up to retain, not only to get the talent, but to retain the talent and develop through continuous training is very important. And technology upgradation is absolutely critical in today's time. You see, you cannot run a hospital successfully without use of optimum technology. It has, you see, India lives in remotes, but more hospitals are in the metros. So teleconsult, which I mentioned, so many far-flung areas are being connected through teleconsult. So that is also a very important thing going forward. And also now, because COVID has come, but otherwise, we are going through a pandemic of non-communicable diseases. These are especially cancer, the blood pressure, plus the diabetes. So in the pandemic of the NCDs also, we have to balance our life, have a healthy work style, and eat healthy food, go for regular exercises, because simple things make a lot of difference. And healthcare today is totally process and outcome driven. As I am also an NABH assessor, so there are KPIs. So everything is absolutely based on the dashboard. It's not anything by idea. Everything is very well structured. And I also want to highlight that now we are going towards preventive health more. And also in future will be on predictive health space. Geriatric health is again one area which is getting more emphasis. Unfortunately, in Asia, we have seen that cancers are diagnosed more in stage 3, more than 62%. But in West, 74% cancers as well as heart disorders are diagnosed in stage 1 in early. And you have cancer in stage 1 or heart disease with single vessel. But in Asia, we found more triple vessel disease because of lack of preventive health services. And total health initiatives we need to think about, not only about healthcare, but water standards, availability of quality medicines. And it's a continuous learning experience and healthy lifestyle. I always say, by running, you can increase your endorphins. When you feel happy, you increase your serotonin. So whatever makes you feel happy, and don't take too much stress, because that increases the cortisol and adrenaline level. So health care people have to learn to de-stress themselves, and learning is, I think, one of the biggest de-stress thing which everyone must. And the whole company and there is a fiscal responsibility, social responsibility, but we also have an environmental responsibility for our new next generation. So I really want to thank for this award, Zoya. So a big thank you for this White Page International Inspirational Leader in Asia Award. And I thank the editorial team for giving this honor to me. And it is really a great honor. Thank you. Thank you very much.
Thank you so much. That's what I was going to ask you, if you would like to say like a few words to our viewers on winning the award for Asia's 100 Inspirational Leaders for 2022.
It's a great honor, Zoya. It's a great honor and great inspiration. It has increased my serotonin level. It has made me more happy. And definitely you get rewarded for doing good work. It also is a very big motivation to continuously perform and outperform in your field. So I am very much honored to get this type of award from White Page International, which is one of the very, very highly reputed body. And indeed, I think I'll keep the flag flying high and continuously strive for excellence in healthcare. Thank you so very much. I don't have words to express happiness.
Thank you. It was very nice talking to you, Dr. Sandeep. Thank you so much. And to all our viewers, we'll be back with another segment soon. Till then, take care.
Thank you very much.